Transplants and frontline is a fairly controversial issue right now in mantle cell lymphoma. Historically, all patients who are young and fit enough were treated with high-dose induction therapy and subsequently taken to a stem cell transplantation. Through some retrospective data and looking at more information, what we've sort of come to realize is the sort of key to long-term responses in this. It's not necessarily the treatment, but hopefully reaching a point of what we call MRD undetectable, in addition to radiographic remission. It does appear, at least from some of the data we have, that patients who are MRD undetectable tend to have much longer progression-free survival and overall survival. At this point, some of these studies have also evaluated the role of whether to get to these endpoints is autologous stem cell transplantation really necessary. As part of this, there is a large national cooperative group study ongoing at this point to evaluate any induction regimen with an evaluation of MRD undetectability at the end with a subsequent randomization to auto transplant plus maintenance therapy or just maintenance therapy alone. We hope to sort of get from this trial whether obviously if there's any benefit to an auto transplant in patients who are MRD undetectable. There are also several smaller should I say, institutional studies that are looking at novel upfront therapies that will avoid cytotoxic chemotherapy agents and do not necessarily include autologous stem cell transplantation up front. Again, another way of evaluating the need of even cytotoxic chemotherapy drugs and also stem cell transplantation. So the next couple of years will obviously be very exciting as we get more and more information about different ways of trying to treat patients with a very rare but important and interesting lymphoma.